Hi there. My name is Shelby, and I'm a licensed substance abuse counselor at the Jackie Nitschke Center here in beautiful Green Bay, Wisconsin. This video is the first in a series that I will be presenting, and it's going to cover many of the basics of addiction, including what it is, when it becomes a problem, as well as the stages of use. For the purpose of this video, I will be referring to alcohol as a drug so that it can be used as an all-encompassing term. Addiction affects hundreds of thousands of lives every day here in the United States. The purpose of this series is to educate those who may know someone with a substance abuse problem but aren't sure what addiction is, what steps to take, or are simply curious of what addiction looks like and what harm it can cause. It's important to remember that as a loved one of someone struggling with chemical dependency, that you didn't cause it, you can't cure it, and you cannot control it. First things first, let's talk about what addiction is. The American Society of Addiction Medicine defines addiction as a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addictions engage in substance use or behaviors that become compulsive and often continue to do so despite harmful consequences. Let me clarify though, addiction does not have to just be a substance. It can be shopping, eating, sex, sleeping, gambling, the list goes on. But just for today in this video, we're going to be focusing on the addiction of mind-altering substances only. Here are just a few statistics. These numbers are a result of the Substance Abuse and Mental Health Services Administration 2018 National Survey on Drug Use and Health. So this survey and these statistics are only 2 years old. In 2018, more than 20 million Americans ages 12 and older battled a substance use addiction, with 14.8 million being alcohol-related and 8.1 million being illicit drug-related. Some more statistics. 130 Americans die every day from an opioid overdose in the United States alone. Americans are more likely to die from an opioid overdose than in a car accident. Alcohol and drug addictions cost the U.S. economy over $600 billion every year. 37% of those who misuse opioids originally got them through a legal prescription from their doctors. 80% of heroin addiction begins with prescription opioids. Another interesting statistic is that the likelihood of developing a gambling addiction increases by 2,300% for people affected by alcohol use disorders. So those are just a few statistics I wanted to throw out to you guys. It's also important to remember that these are only the numbers that are reported. Often substance abuse goes unreported due to shame, embarrassment, and the social stigma that is connected to addiction. So what makes addiction a disease? A disease is defined as a disorder of structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms, or that affects a specific location and is not simply a direct result of a physical injury. But let's break it down a little bit further. As a biopsychosocial disease, addiction causes measurable changes in both the structure and function of the brain, which is the biology component. Changes in a person's thinking and ability to reason, which is the psychology component. And lastly, as these changes occur, there's also changes in the person's social behaviors that happen, which is the social part. This can cause a ripple effect of issues throughout every aspect of a person's life. So just as an example, to show all of these parts of the biopsychosocial model combined, let's take the example of somebody that's been drinking heavily for a prolonged period of time and is struggling with alcohol dependence. Biologically, the prefrontal cortex of their brain is damaged, which is an essential part of decision making. There have been studies done on the brains of chemical dependence, and these studies have revealed that those who struggled with addiction showed decreased activity in the frontal cortex. If the frontal cortex is malfunctioning, the person is unable to make this decision to stop their drug use, even if the consequences of doing so are extreme. Psychologically, they may experience anxiety, depression, or any number of mental concerns, or their drinking may already exacerbate an existing mental health disorder. Socially, they might isolate themselves away from their friends, their relationships with their family and significant other may suffer. If they receive a DUI or other legal ramifications, it's a concern for the society. So the bio and psycho are more focused on the person, and the social component kind of shows how it can affect the community and the loved ones of the chemical dependent. Real quick though, it is important to note that most drug use is not about the drug per se, but rather how the user is choosing to cope with their life. A lot of people who struggle with substance abuse may have experienced trauma or have a history of trauma, but this is something that they are going to have difficulty coping with. We often see a history of trauma with clients who are in treatment for chemical dependency. So an example of this could be Margot. This is just a hypothetical example. She was sexually abused by a family friend as a child due to shame, embarrassment, maybe even feelings of betrayal. She did not tell anyone about the abuse. Because of the trauma and lack of support then, she began to experiment with drugs and alcohol and found that alcohol was briefly effective in numbing her shame, sadness, anger, all of the encompassing negative emotions she has regarding that trauma. A different example of this could be Leo, who is a younger person. He has struggled with a learning disability for most of his life. His peers would purposefully leave him out of gatherings, which made it very hard for Leo to connect with his peers and make friends. While being invited to a party in high school, he was trying to fit in with his peers. He tried cocaine. Everybody else was using cocaine, so he tried it too to fit in. He noticed that it made him feel more confident, less insecure, and more comfortable around his peers. So these are just two vague hypothetical examples that show how abuse and other various traumatic events can lead a person to experimentation, which, when not dealt with properly, the trauma, can then lead to dependence. With that being said, please remember, it is crucial to remember that although a lot of those who struggle with addiction have experienced trauma or have an extensive history of abuse or trauma, not all who experience this struggle with substance abuse. So, there is a line that gets crossed during the stages of use that I will explain. First, though, I want to explain the more obvious comparisons of dependent and non-dependent drug users. Non-dependent drug users are going to decrease or completely stop their drug use after negative consequences, whereas a dependent drug user will continue to use drugs despite negative consequences that they may be experiencing. This could be DUIs, health complications, relationship issues, financial issues, and job loss, just to name a few. The stages of use are as follows. First, there is experimentation, which is using drugs curiously. Going back to our examples of Margot and Leo, an example of experimentation could be when they were teenagers trying alcohol, marijuana, hallucinogens, cocaine for the first few times to experience their effects. There is a conscious choice at this point to partake in the drug use, and the drug use is done fairly sporadically and randomly. Next, we go down to regular use, which means exactly what it sounds like, using drugs fairly frequently. For example, this would look like Margot drinking and Leo using cocaine in a more predictable pattern, and their responsibilities may begin to suffer and be pushed to the back burner, like work in Margot's case or college in Leo's case. Next, we have risky use or abuse, which is when we begin to see a person living to use, and they become hyper-focused on their drug of choice and feeling its effects. Someone at this stage would be using drugs more often now, generally multiple times a week, and is preoccupied with getting intoxicated. They'll also begin to experience negative repercussions of their choices. Going back to our Margot and Leo examples, Leo begins using cocaine 4 to 5 times a week and is receiving poor grades in school due to his lack of participation and attendance in his college classes. Margot may experience disciplinary issues at work because she's calling in multiple times a month due to being hungover, or maybe even missing her scheduled shifts altogether. And then finally, there is the last stage, which is dependence, which is when a person is using their drug of choice to live and quote-unquote feel normal. This is someone who is using multiple times a week, if not on a daily basis, and has to continue to use in order to achieve a baseline feeling of comfort. This is also a time when people are using to relieve any withdrawal symptoms or pain that they're experiencing from withdrawal. Back to our examples of Margot and Leo. Margot is drinking up to 1 liter of alcohol a day and can't control the amounts that she's drinking. She has lost her job because of her alcohol use, which causes financial burden on their family and arguments with her spouse, which she then drinks to numb. Leo is using cocaine continuously and can no longer afford to attend college, as he's using up to 1 gram of cocaine a day. Because of this, he drops out of school, which then causes tension between him and his parents. After someone becomes dependent and crosses that line, they're unable to go back to any of the earlier stages, as addiction is a progressive disease, meaning that it always moves forward. As we say here at JNC, once you're a pickle, you can't go back to being a cucumber. Instead, you're always going to be a pickle. Additional descriptors of chemical dependency are primary, progressive, chronic, and incurable. It is a primary disease, meaning that chemical dependency causes problems, such as health complications. Problems do not cause the chemical dependency. An example of this could be Margot's doctor has advised her to decrease her alcohol intake because she had high liver enzymes as well as high blood pressure. These are not conditions that she had prior to her chemical dependency, but instead are a direct result of this. Addiction is chronic because it is an incurable disease that people will live with for the rest of their lives. Although there is no cure, there is recovery. Similar to taking insulin for type 1 diabetes or taking medication for hypothyroidism, addiction can be treated into remission. But if someone were to stop working their recovery or relapse, the addiction will come back with a vengeance and continue to progress. Addiction is progressive, which means that the disease will get worse, not better if untreated. One cannot go back to the start of their addiction and start all over again. That's not how this works. If the disease continues to progress untreated, this generally leads to 3 options: institutions, insanity, or death. If left untreated as it progresses, it will eventually have serious effects on every aspect of the person's life. For the sake of time, I'll break this down into what I call the 8 major life areas. With each life area, as I name it off, I will also include a few examples in there as well. So the first one is physical health, which could mean cirrhosis of the liver, hepatitis C, pancreatitis. Next we have mental and emotional health, which could result in anxiety or depression. Family, which could mean arguments with parents or spouse regarding the person's substance abuse. Friends and recreation, no longer spending time with friends or spending time doing the hobbies that you enjoy to do. Financial, spending large sums of money to continue your substance use. Occupational, disciplinary issues for showing up late or calling in too many times, maybe even coming to work under the influence and losing your job. Legal, perhaps receiving an OWI, maybe even getting arrested for possession of an illegal substance. And finally, spiritual and self-esteem, lacking self-confidence and maybe not feeling any connection to a higher power. As I stated earlier, addiction has no cure, but the good news is it is preventable and it can be treated. One of the tools that mental health professionals use to diagnose chemical dependency is something called the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders by the American Psychiatric Association. There is a process that mental health providers go through in diagnosing chemical dependency. There are actually 11 different criteria that we work through when we suspect abuse, but these are just a few of them. Loss of control over amounts of drugs or alcohol used, strong or persistent cravings to continue their drug or alcohol use, persistent use of drugs or alcohol despite consequences such as fights with family, neglecting responsibilities, poor school or job performance, legal repercussions, etc. Increased tolerance, which means they need to use more in order to achieve the desired effect to continue their use. And physical withdrawal symptoms when they stop using their drug of choice, such as shaking, vomiting, dizziness, sweating, similar to a flu virus. As I said before, these are just a few of the different criteria that professionals look for specifically in someone that they feel may be struggling with a substance abuse problem. Addiction itself is a cunning, baffling, and powerful disease that requires a lot of work to change the chemical dependent's thoughts, attitudes, and behaviors. I do want to take a few moments to discuss the different forms of withdrawal that people will experience. So first, there's something that we call acute withdrawal. This is accompanied by physical symptoms such as nausea, vomiting, sweating, diarrhea, dizziness, sleep irregularities, maybe sleeping too much, inability to sleep at all, difficulty with focusing and headaches, things like that. Then, after the acute withdrawal has subsided, there's something that people may experience known as post-acute withdrawal, or PAWS as we call them. Post-acute withdrawal symptoms can take anywhere from a few months to 2 years to subside, all depending on how much the person was using, what drug they were using, and how long they were abusing their substances. Symptoms of PAWS can include hostility or aggression, anxiety, irritability or mood swings, increased sensitivity to stressful situations, long-term memory loss, just to name a few. These can be very troubling and stressful symptoms to experience, but it is important to remember that there are always alternative ways of coping with these symptoms and that they will not last forever. Treatment for substance abuse is different for everyone, including detox, rehabilitation centers, sober living facilities, and aftercare programs. It's important to remember that everyone's journey to recovery is different, but will have very similar components such as coping skills. I don't want to take a lot of time to focus on the recovery aspect because, as I stated at the beginning of this video, it is aimed more towards family and friends of someone struggling with chemical dependency. One of the more prominent difficulties that those struggling with substance abuse will experience is something called denial. Denial is one of the biggest obstacles that we encounter as substance abuse counselors, especially because it is such a strong defense mechanism. There are many different forms and levels of denial, and the scary thing is that denial can occur at any stage of someone's recovery. For example, someone may be struggling with a substance abuse problem, something happens to them, losing their job, legal issues, relationship problems. They finally agree to enter some level of treatment. Just because they're in some form of rehabilitation does not mean that their denial simply goes away. They may have denial about how much they were using, they may have denial about how their using affected their friends and family, or they may simply have denial about the fact that addiction is a lifelong illness that they will fight the rest of their lives. Denial can show just how truly powerless someone is regarding their addiction, and it exists to keep the person sick. Addiction feeds off of denial and uses denial to keep the person blind to the reality of their disease. Denial does not just occur in the person struggling with the chemical dependency. Oftentimes, many friends and family will deny that there is a problem. But please realize that if you are feeling this way or have ever felt this way in the past, that it is absolutely normal and that you are not alone. Then there's something called enabling. As you can tell, I favored diagrams. Enabling is when someone does something for someone that they can and should do for themselves. An enabling person will fix, solve, or make consequences go away for the chemical dependent. When combined with denial, this creates a powerful and dangerous outcome, allowing the chemical dependent person to continue to use without feeling the full repercussions of their actions. It is not uncommon for friends and family of those struggling with addiction to find themselves participating in enabling behaviors. We understand that this is done from a place of love. Of course, you want to help your loved one. But it's important to consider what the repercussions can be from your acts of kindness. Familial enabling and denial is something that we're going to get into further in one of the other videos. So for right now, I just wanted to briefly touch on the importance of these two subjects and how they play in fueling chemical dependency. We can discuss specific examples of denial and enabling in a later video. So, as I have already stated many times, although addiction is chronic, there is recovery. But it's also important to note the difference between abstinence versus recovery. Abstinence is exactly what it sounds like. You are abstaining from harmful substances or behaviors. So you can remove the harmful substances or behaviors, but that's where it ends. Recovery is removing the harmful substances or behaviors, working to change one's behaviors, and then continuously repeating these over a prolonged period of time. Someone can be abstinent from illicit substances, but still have the same behaviors and attitudes as when they were using. This is something that we refer to as a dry drunk. An example of this could be if Margot stopped drinking, but did not work any form of recovery and simply white-knuckled her sobriety. She may continue to do the same behaviors that she did while she was actively drinking, such as lying, blaming others, and harboring resentments. But because she's not drinking, she is still considered abstinent. The other end of the abstinent recovery spectrum could be Leo, who has stopped using all illicit substances, is actively working a recovery program, for example, a 12-step program, and is taking the appropriate actions to change his life for the better. The final portion of this video I would like to spend discussing addiction prevention. One of the most important parts of addiction prevention is education. Especially with preteens and young adults, it's important to discuss drug and alcohol use at a young age and to allow them to ask you questions. Try not to let it be a taboo subject in your household in order to encourage helpful and open communication. Another important component of substance abuse prevention is to use healthy coping skills when you're feeling stressed, upset, or any other emotion you may view as negative. The more you utilize healthy coping skills, such as biking, drawing, reading, playing outside, whatever they are, the more you solidify them as your brain's go-to responses the next time you have a bad day at work or an argument with your significant other. And lastly, do not be afraid to seek help when struggling with mental health concerns. This is a big factor and why many people begin using substances in the first place to numb the negative thoughts and emotions that they're feeling. So in order to prevent that, reaching out, talking to someone, asking for help, remember there is no shame in reaching out. In closing, I want to thank you for joining me in this video. I hope it was educational and answered some of your questions or concerns that you may have about loved ones of someone that is struggling with substance abuse. And if there is one thing that I hope you take away from this video, it is that you are not alone, that you can reach out, and that there are others facing the exact same difficulties as you, that there is no shame in asking for help. And remember, as the 3 C's of Al-Anon state, you did not cause it, you can't control it, and you cannot cure it. Be well, make good choices, and thank you.